Hello everyone. We'll wait for some 5 minutes to let everyone join and then we'll start the session. Hello everyone. We'll start the session now. I hope I'm audible and my screen is visible to everyone. Can someone confirm?
Yes, ma'am.
Okay, thank you. Okay, welcome to 12th TA session for Drug Delivery Principles and Engineering. And in the past week, these were the topics that were covered. Okay, so in the last week, these were the topics that were covered: responsive delivery systems, targeted drug delivery systems, and nanotoxicology and their translation pathways. And based on this, we have some previous assignment and few other questions that we'll discuss today. Okay. Here is the first question. What are GMP and QS regulations? The options are: the QS regulations apply to drugs which are being tested in vitro. The GMP regulations apply to things which are intended to be used in humans. Contamination can be caused by residues of cleaning agents, or quality check is ensured only at the end of the manufacturing process. Which of these options do you think is the correct answer?
Option 2.
Option 2. Okay. Anybody else?
Option 2.
Okay. Okay, both of you are correct. It would be option 2. GMP regulations apply to things which are intended to be used in humans. So, GMP is good manufacturing practice and QS quality system regulations. These regulations require that the domestic or foreign manufacturers they have a quality system for the design, manufacture, basically at each step of the manufacturing from the start to towards the end of distribution. It should follow all the manufacturing good manufacturing practice, and it should pass the quality system regulations. And anything used in humans should follow all of the guidelines that are there. So option 2 would be the correct answer. Moving on to the next question. So NIPAM is a temperature responsive hydrogel. The following are its characteristics. Their water solubility increases with temperature, it decreases with the temperature, consists of polymer chains which are made up of hydrophilic segments only. Van der Waals forces are the predominant forces that are responsible for dissolution in water. As the temperature increases, the hydrogel become more porous or more hydrophobic content in the polymer leads animals such as primates.
Option 2.
Okay. Anybody else?
Option 2.
Option 2. Okay. Okay. Both of you are correct. Their water solubility decreases with temperature. So this temperature responsive hydrogel, basically this particular polymer, uh, its water solubility decreases as it crosses the lower critical solution temperature. Yeah, so this water solubility of this polymer decreases as the lower critical solution temperature increases and or it crosses, and they have this hydrophobic and hydrophilic segments. So as the temperature increases, the hydrophobic interactions increase and more than the hydrophilic interaction of the polymer with the water, which is why it leads to decreased solubility of this polymer as the temperature increases. Okay, moving on to the next question. What happens during phase 3 clinical trials? Here you have to select two correct options.
Option 1 and 2.
1 and 2. Okay,
No, ma'am. 1 and 3.
1 and 3. Okay,
Option 3 and 4.
3 and 4. Okay,
Option 1 and 3.
1 and 3. Okay, anybody else would like to answer? Okay, so the correct answer would be option 1 and 3. Safe dosage is determined and it is generally a multi-layer and multi-center process. The last option, studies are performed on large animals such as primates, is basically a preclinical trial and not the actual clinical trial. And basically, in the three phases of the clinical trials, in the first phase, there are small numbers to assess the product safety, and it is generalized to very few centers. And in phase 2, proper or safe dosing and the efficacy of the drug or whatever is tested, product is tested, is determined. And in the final study or the phase 3 study, it is very well controlled clinical trial that supports both safety, efficacy, and it involves multi-center involvement. And basically, what determines whether the product will finally be available for in the market or not. So the option 1 and 3, safe dosage as well as multi-layer and multi-center process, both of these options will be correct here. Okay, moving on to the next question. What is meant by sterilization?
Elimination of contamination.
Okay, anybody else?
Option 3.
Okay, what about others? It's an easy question. Anybody else? Yes, both of you are correct. Sterilization is basically elimination of contamination. Okay, next question. Which of the following are not examples of active targeting? You have to select two correct options here.
Option 4 and 5.
4 and 5. Okay.
Last option.
Okay. Anybody else? Anyone else would like to answer? Which of the following are not examples of active targeting? Okay, so the last two options will be the correct answer. EPR effect or enhanced permeation and retention effect and direct local delivery to target organ. That along with the tumor environment, these are all very basic passive targeting, because you are just injecting it and hoping it will lead to treatment of those cancer specific, it will lead to delivery to those cancer specific or any disease specific delivery. But in active targeting, you have specific modification or basically interaction that you are utilizing to actively target only those disease specific antibodies or some carbohydrates or ligands or receptors present in those, using lectin carbohydrate interaction or ligand receptor or antibody antigen interaction. So EPR effect and direct local delivery to target organ are passive targeting, are not examples of active targeting. Okay, moving on to the next question. What are the main disadvantages of aptamer? You have to select two correct options here.
Option 2 and 4. Option 2 and 4. 2 and 4.
Okay. Anybody else would like to answer?
Option 2 and 4.
Okay. Yes, all of you are correct. Option 2, they do not interact with negatively charged targets, and option 4 can be detected by toll-like receptors would be the correct answers. So aptamers are basically small oligonucleotides, and with this technology, you can target specific uh, ligands. And the main shortcoming would be these are on nucleotides, so they are already negatively charged. So due to their negative charge, they don't interact with other negative charge targets, and they could be detected by toll-like receptors as foreign DNA. So these two options are the correct answer. Okay, next question. Again, another temperature sensitive hydrogel based. Which of the following correctly describes the mechanism of temperature sensitive hydrogels?
Option 2.
Option 2. Okay.
Option 2 and 4.
Okay. What about others? Yes, anybody else? Which of the following correctly describes the mechanism of temperature sensitive hydrogels?
Option 2.
Option 2. Okay. Anybody else? Okay, so the correct answer would be both option B and D. So these temperature sensitive hydrogels are, for example, the NIPAM one that we studied so far, they dissolve at lower temperatures because of increased hydrophilic interactions or the dominant hydrophilic interactions over hydrophobic interactions. And as the temperature increases, the hydrophobic interactions become dominant, which leads to shrinkage of the hydrogels and more interaction of hydrophobic compartments, leading to formation of the gel. So they shrink as the temperature increases due to strengthened hydrophobic interactions and dissolve at lower temperature due to weakened hydrophobic interactions or basically dominant hydrophilic interactions. Okay, moving on to the next question. Which of the following statement is false for enteric coatings?
Option 4.
Option, okay.
Option 4.
Okay. Anybody else? Yes, anybody else would like to answer? Which of the following is false for enteric coatings? Okay. So the correct answer is the fourth option, allows delivery of drugs in the stomach. So enteric coating is basically where you are using this polymer that is insoluble at low pH, such as in the stomach, but it delivers at a more basic pH, which is there in the small intestine. So it is basically becomes pH responsive and insoluble at low pH and soluble at physiological pH. It protects the acid sensitive drugs from gastric juices in the stomach and delivers to the small intestine, can be made up of polycarboxylic acid, but it prevents delivery of drugs in the stomach. So this will be a false statement, or option 4, allows delivery of drugs in the stomach, will be the correct answer. Okay, moving on to the next question. Poly-NN diethylacrylamide is widely used as temperature responsive hydrogel because of its LCST, or lower critical solution temperature, in the range of
25 to 32 degrees Celsius.
okay,
Option 1.
okay,
25 to 32.
okay.
First option is correct.
Okay. Yes, all of you are correct. It's first option, 25 to 32 degrees Celsius. And you can change the ratio of hydrophilic and hydrophobic segments of the polymer to so that it can be used in this range, or to increase or decrease the slightly increase or decrease the gelation in this temperature range. Moving on to the next question, which of the following functional groups would make coating non-labile to acid damage in stomach? We just discussed this question.
Option 3.
Okay,
Carboxylic acid group.
okay. Others?
Carboxyl group, ma'am.
Okay, Anybody else? Okay, the correct answer is carboxylic acid group. In the previous question, we just discussed about enteric coatings, which prevent dissolution of the dissolution of the polymer in the acidic pH of the stomach, but it releases it in the physiological pH. So there, carboxylic acid can be used. So these, if your drug is coated with this polymer that contains numerous carboxylic acid group, that protonates at pH 2, but at higher pH, suppose pH 8 of small intestine, it gets deprotonated and it becomes highly soluble, basically releasing the whatever it contains inside the polymer. So carboxylic acid group would be the correct answer. Next question, what assays can be conducted to test for nanoparticle toxicity in vitro? You have to select two correct options here.
Option 2 and 3.
2 and 3. Okay.
Option 2 and 3.
Okay. What about others? What assays can be conducted to test the nanoparticle toxicity in vitro? Yes, anybody else? Okay, so the correct answer is option 2 and 3, hemolysis and cell metabolism assays. Both of these assays are used to test the toxicity of the nanoparticle in vitro. In the hemolysis assay, you basically expose your material to blood and see how much damage it is causing to the RBCs. And in the cell metabolism assays, the same thing, you expose them to a specific either primary or a cell line and check the activity of these cells using reagents, metabolic activity of these cells using reagents to determine their toxicity. Okay, we have our next question here. Which of the following is not a characteristic of pH sensitive hydrogels?
Option A.
Okay,
Option A.
okay,
Option A, ma'am.
okay. What about others? Anyone else would like to answer? Which of these is not a characteristic of pH sensitive hydrogels? Okay. So here the correct answer would be option D. They maintain a constant drug release regardless of the pH. So if you are making a pH sensitive hydrogel, it should release the drug only at the uh, desired pH that you want. So the enteric coating that we are using, that is also pH sensitive, but you have designed the hydrogel such that, or the drug delivery such that it releases at a specific pH. But if you specifically want to deliver it to the stomach, you can also design it the other way around, right? So that it releases the drug at acidic pH of the stomach. So pH sensitive hydrogels is like a common term, and they are really useful for drug release in the stomach. They can undergo ionization changes depending on the pH, responsive to the acidic environment of the tumors, but they should not maintain a constant drug release regardless of the pH. Okay, next question. Which of the following describes the main mechanism by which glucose sensitive hydrogels control insulin release?
Option A and C.
A and
C.
A and C. Okay.
Ma'am, option A and C, ma'am.
Okay. What about others? Anybody else would like to answer? Which of the following describes the main mechanism by which glucose sensitive hydrogels control insulin release? Okay, so the correct option here would be option B. Glucose oxidase triggers a pH change leading to a hydrogel swelling and increased insulin permeability. While more or less option A and C do describe the mechanism, but the actual main mechanism involved is the glucose oxidase, which triggers a pH change leading to shrinkage of the polymer that leads to opening of pore and increasing the permeability of insulin through the hydrogel. Okay, moving on to the next question. Which of the following statements about temperature responsive hydrogel is false?
A, ma'am. Option C.
Sorry?
Option C.
C. Okay. Anybody else would like to answer? Which of these is a false statement regarding temperature responsive hydrogels? Okay, so the correct answer would be option C. They become more hydrophilic as the temperature increases. This is the only false option here. So instead of becoming more hydrophilic, the hydrophobic interactions become dominant and it becomes more hydrophobic, which leads to formation of the gel as the temperature increases. Okay, so that's all the questions I had for today. And if anybody has any other doubts or wants me to go through any question again, please let me know.
Ma'am, the question after the 10th question, may I know what's the answer?
Which 10th question? This one?
Yeah, after the 10th.
Which of the following is not a characteristic of pH sensitive hydrogels? So they
Yes.
maintain a constant drug release regardless of pH. So if you are making a
Uh,
pH sensitive hydrogel, it should be pH sensitive, right? It should release at a specific pH that such that you the way that you have designed. But if it
oh,
is maintaining a constant drug release, it is defeating the purpose. So that will be the correct answer.
oh, thank you.
Yeah.
Excuse me, ma'am.
Yes.
Ma'am, I wanted to ask like the starting of the course, they sent the mail that you have to register for the examination. I registered by
Okay.
paying the fee also. But after that, the course must be completed right now. Now again they are sending the mail that you have to register for the exam.
Your voice got cut off. So if I uh, so you are basically saying you registered once by paying and again they are sending you mail to register, is it?
Yes, ma'am. At the starting of the course, they were sending the mails that you have to register for the exam. If not, it will be closed. I registered at the starting of the course itself. But now again they are sending the mail that for July 2024 courses you have to register for the exam now. But I have already registered. Is it like I have to register again?
Um, I am actually not quite sure, but you can put a query to the NPTEL team, or you might have the registration mail that you received previously, right? I mean, if you have paid for that, you would have the receipt with you, the payment thing. So just try to share it with them and ask them that you have already registered for it. The
Okay, ma'am.
technical team handles this, so they'll reply you.
Okay, ma'am.
Okay.
Now I have another query.
Yes.
Actually, in the exam format, it was mentioned saying that for online exams, there will be essay type answers. But since right from the starting of the course, I've heard that it's only objective. So I was not sure looking at that if it's essay type will also be there.
Um, Actually, that also I'm not sure. As far as I know, all of these exams are objective type only. There is no subjective answers. These are like multiple choice, or you have to enter a specific number for numerical questions. Yeah. As far
Okay.
as I know,
Okay.
it should be objective. Yes.
Oh, thank you.
Okay. Any other thing anyone wants to discuss? If not, we can close this session here. And there is another extra session on 18th. So that will be the last session. So if anybody else has any other question, let me know. Else we can close here.